Welcome to B2B Synergy, the Power Partners USA podcast, your exclusive guide to discovering the potential of B2B partnerships. I'm Alan Armijo, owner of Power Partners USA business-to-business introduction and referral service. Our members are B2B professionals who team up to provide each other repeat referral business or collaboration. Today's episode shines the light on Kreisler Ng, president and owner of Right at Home Long Beach. Kreisler, I'm really looking forward to this conversation. I'm looking to understand your work in home care services and how you help families navigate aging, recovery, and long-term care needs while allowing loved ones to remain safely at home. So welcome.
Thanks, Alan. Super excited to be on. Thank you for having me.
Sure. Can you explain what services you provide at Right at Home Long Beach?
Yeah, Alan, absolutely. So right at home, Long Beach, we've been servicing the local area, Long Beach and surrounding communities the last 10 plus years. In a nutshell, we're a care agency, or some may call home care agency. So we offer caregivers in the home. So that's our bread and butter. But what I would also say is it goes beyond that, right? So what we take pride in is what's behind a caregiver, whether it's the agency, access to myself as the owner, to my clients. I really get to know my clients. I like to think of it as we're a boutique home care agency. We're not huge by any means. So we're very intimate around that. And then lastly, beyond home care, we have an extensive a network of senior professionals that help people, whether they need to find assisted living, access to different kind of funds like a reverse mortgage, for example. I have a network of financial advisors, people who do elder law attorneys. So just a little bit of both, a little things. So as people want to age in the home safely, we think about the full cycle for them.
Okay, good to know. How do you assess the specific needs of a client before matching him with a caregiver? Do they come through you specifically every time?
Yeah, it's a very good question, Alan. Yes, so typically we do a complimentary in-home consultation or assessment. I am the one going out and meeting all my clients before any caregivers show up. And typically that conversation, very casual. Sometimes I might call it a meet and greet. It's 30 minutes to an hour where we are assessing and observing the person or the loved one in the home, whether it's their daily routines, understanding their personalities, what kind of help do they need? Example, such as, is it meal prep? Do they need help getting to the restroom? Do they need help taking errands, going on errands, or medication reminders? Those are all things we look at. And then lastly, I always tell my clients, it's like dating. The first 2-3 weeks, we're playing matchmaker with our bench of caregivers along with our clients. Because at the end of the day, we only hire experienced caregivers. So the technical skill sets are there. A lot of times it's a question of, hey, does mom or dad like the caregiver coming in? Do they look forward to it? Do they find joy in having companionship and the caregiver take care of them?
So in your case, your involvement, the matching of the caregiver, and you stay involved as that process develops, that relationship develops, and then are there any other follow-ups that you are hands-on with?
Yes, absolutely, Alan. So I like to stay hands-on throughout my entire client's life cycle with us, and I'll be upfront even beyond that. So what that looks like is a lot of times, depending on the level of acuity of the client, I'll be making visits every 2 to 4 weeks with clients in the home. And so just checking on with the client, as well as we check in with our caregivers on a weekly basis, making sure that they're comfortable, that they have the tools they need to be successful in the home. And I say beyond that because actually just last week I visited 2 widows that were our clients last year, and just making sure that they're okay. And we become friends actually, right? Just at the end of the day, it's very much a human business. And so I think of it beyond my clients, right? I think of it as I'm trying to take care of them and they need support and help. And that's really how I got into this space, was that.
Oh, yes. And I noticed you're a franchise, right? What advantage does having a franchise have in the industry?
Yes. So I'm an independently owned franchise. And I would say the main advantage is we're hyper local, number one. So all our caregivers, because we have a territory, all our caregivers are within 10 to 15 square miles of the client's home at any given time. And number two, that makes us very uniquely positioned to understand the environment, right? And the context of the community that the loved one lives in. And then also being a part of a franchise, there's a lot of tools and systems in place that are given to us, as well as updated across the board. So Right at Home itself is, I believe it's the number 2 or number 3 largest home care agency in the nation. So think of it as mass amounts of data, right? Where you have 800 plus businesses trying different things, and then we bring it back to the franchise, and then we share it with the entire network of what's working, what's not working, as we take care of our various clients.
Oh, so you have that backup, that resource to call on.
Yes, yes.
Great. Because besides, do you also have clients that are like discharged from hospital, or what does your typical client look like?
Yeah, so it varies depending on the situation, Alan. We'll take people that need care within 24, 48 hours. That's usually when discharges happen, whether it's in a skilled nursing facility or a hospital, as an example. A lot of our clients are not necessarily high acuity. They really only need 16, 20 hours of home care every week. And so just to stay safe in the home, right? Or to give a break for a family member who's a family caregiver, as an example. So it just varies. I've had clients as little as 4 hours a week. They just need a little extra help, all the way down to 24/7, right? And again, it just depends on the need.
And that territory again is Long Beach to where? Up north?
Yeah, so Long Beach, San Pedro, and we moved north to Downey, Lakewood, Bellflower, Southgate, Paramount.
Do you go up to Montebello too?
On occasion,
Okay.
depending.
But
Yeah.
that would be part of your territory.
Yes,
Okay. Any contacts we have in those areas would be good prospects for you, right?
correct.
Okay, good. How would you say, what areas of specialization or what differentiates you from other care service agencies?
Yeah, very good question, Alan. And I think I touched upon it a little bit earlier just now. The biggest thing is we're boutique and hands-on, right? When someone picks up the phone or calls us, half the time it might be my admin staff, and then half the time it's actually me, the owner. And I think that's the biggest differentiator. We're not looking to grow into some large, big home care agency. We're looking to make an impact on a small number of clients at any given time. And so super hands-on, very easable, reachable, right? 24/7 access to us. And we just like to work with our clients, right? Because we know at the end of the day, this is a very intimate, it's about a trust-based type of service. We're going into people's homes, we're a guest in their homes. And so we want to be very careful about that when people allow us into their homes and trust us.
Okay, great. Okay, so people needing home care service, minimum 4 hours do you do
Mhm.
24-hour service too?
Yes, we do.
And that could be a range of families. Everybody has aging parents. So
Mhm.
th there's people that could use your service, right? But is there any other type of specific industry type or client that you're looking to target? Or is it mostly just general across the board in that regard?
That's our biggest, I would say, client census. We do at times post surgery if someone's recovering from post surgery. So you don't necessarily have to be a senior or elderly. As long as you're over 18, our license allows us to take care of someone in the home. So whether it's post surgery, adults with disabilities, we do that as well.
Okay. And then how are you paid by the families, or in a post-surgery case, does insurance play in any of this?
Yeah, so most insurance, and this is where I think it's a myth or people falsely assume that insurance will cover home care, specifically caregivers. So Medicare, HMO plans, Advantage plans, all those cover the skilled side, they call it, right? Or the medical side. So nurses going in, hospice, home health, PT. In terms of caregivers, most plans do not cover us. A lot of times it's going to be private pay out of pocket. We are VA accredited, so we do help veterans get their VA health benefits. So the VA can help with some home care. And then there are some HMO Advantage plans that do cover home care, but it's a small amount, typically every calendar year that they cover.
Okay. And do you want to get into the cost or your cost for home care in the sense of average rates, and how are you finding people willing to pay or their expenses, especially if it's coming out of the family? In other words, who are you dealing with? The kids?
Yeah.
Oh,
Yeah, no, it's a very good question. What happens a lot is That's why the in-home consultation is very important. I think a lot of times when I talk with families, when they call us, they almost assume it's 8 hours a day. It's very standard, right? If you think you work 8 hours a day, you're thinking, okay, it's going to be 8 hours a day, 40 hours a week, let's say. Most often people don't need that much. As I said, most of my clients are somewhere between 16 hours a week, maybe 20 at most. And so I like to work with families in the consultation and figure out what are your actual needs and what can we get away with? What is your budget? And just like anything else, it's a trade-off of a balance of risk, right? So I'll give you an example, Alan, for your audience. We did a post-surgery, I think it was last year, yeah, and the person was bedbound the first month. No use of their arms, essentially couldn't get out of bed themselves, but they didn't need 12 hours a day. You would think, oh, maybe they do, but what we worked through was we would have a morning routine. It was about 4 or 5 hours a shift. Get them out of bed. Remember, they couldn't get out of bed. Get them out of bed, make them breakfast. If they want to shower or bath, we give them a bath, right? Get them ready for lunch. And then our caregiver left, and they were alone in the home for about 4 or 5 hours. Then we had another caregiver come, an evening caregiver, do a nighttime routine. So it was another 4 hours, getting them dinner, making them ready for bed, changing them, helping them brush their teeth, and then putting them in bed for the night. So just to give you an example of how we split things up. Number two is we also want to think about the efficiency of the caregiver on the shift. So whatever they can do while they're there, whether it's light housekeeping beyond caring for the person, they will do as well, right? And then, so we think about that in terms of hours. And then in terms of pay, it ranges in LA County where we're at. It ranges anywhere from $30 to $40 an hour based on that. And so how we price it is we base it on number of hours and level of care. So if someone is bedbound, that's obviously takes a lot higher skilled caregiver. Maybe they have to change diapers, or they have to rotate the person in bed because they can't get out of bed. So that rate goes up a little bit more based on that. But we work with families and trying to figure out their budget, what their needs are. If there are any other subsidized programs that we know of, we will. As an example, there's currently a program in Medicare called Guide Dementia that does provide up to 72 hours of home care for a dementia patient in the home. So we'll exhaust everything. Or if someone has the long-term care insurance plan, those were popular in the 90s and early 2000s. A lot of people may not know they have that. That can be very generous around paying for home care in the home as well.
Right. So all that comes out in the conversation with the family when they first talk to you initially.
Correct. Yes.
Good to know that you're up on all of that, even these new things like the dementia. I hadn't heard of that. I want to get back a little more detail into this and your YouTube channel, but I wanted to switch gears a little bit. We're a Power Partner Network. As a reminder to our listeners, Power Partners is a B2B introduction service. We introduce business professionals to each other who can provide each other repeat leads and referrals or do business collaboration. We are targeting this podcast to your Power Partners, Kreisler, to bring you more repeat referral business. Who are your Power Partners? Who do you find yourself working with that is giving you a repeat referral or you're collaborating with?
Yeah. For me, Alan, my Power Partners are, of course, healthcare professionals that mainly deal with seniors or geriatric doctors, right? I also work with people that are elder law attorneys or fiduciaries or conservators. Those are folks, again, dealing with people elderly, or they might be involved in healthcare decisions and or budgetary decisions about taking care of someone. Those are my main Power Partners. But you even touched upon it, Alan, right? At the end of the day, we all have aging parents. We've all seen the trends. I think, I don't know what it is now, like 12,000 people retire every day in the US. And so there's a lot of people that want to stay at home. They've done the studies that people live longer and are happier staying in the home. And so I'm always out in the community just advocating for people that what we can do and how people can stay safe in the home longer.
So they're coming to you or they're saying, we want to stay in the home as opposed to going to an assisted living facility or something, right? Community,
Mhm.
which is a lot more expensive monthly, right?
Yes, I always say there's a tipping point, right? So if you think about it, assisted living there's a curriculum, right? There's food, there's activities. It's like a cruise ship, right? Usually that's what I always say, a cruise ship that never leaves. But it's a cookie cutter, right? That's how they do it, right? It's at scale. It's not one-on-one coverage, right? It might be like one caregiver to 8 residents, as an example. So there's a time and place for that, right? Versus home care, as I touched upon, it's highly customizable. It can scale based on needs, right? I've had people get better after surgery and they'll start winding their hours down. You can't do that in assisted living. You're there, right? You're leasing a spot for at least for the year. So there's that kind of dichotomy. I'm not saying assisted living is a bad choice for everyone or anyone. It just really depends. Um, but I find most people prefer home care because they to your point, they want to say, I want to stay in the home. I don't want to go to an assisted living as long as possible.
Well,
And then there's a tipping point where home care maybe become too expensive, right? If the acuity of care is too high.
but if the person that's getting the home care, their
Hmm.
intent, knowing that they're eventually going to need it, has always been, I want to stay at home. At some
Yeah,
point, they're going to need a home care service helper. If the family's not doing it,
correct. Yes.
even when the family is doing it, there's respite care, they need a break. There is some element of home care that is in there. So I'm just trying to say how if more people want to do it, they need to know a good home care service provider, right?
Yes. Yeah.
For the
Yeah.
time.
And that's something I do want to touch upon, Alan, is I think people only hear home care. Usually, most people are in a crisis. I'll be honest, right? They're calling and because they think they need it last minute. And I get it, right? If you're being discharged and you need care within 24, 48 hours, I understand. But I always tell people, as you have aging parents, I have aging parents. My brother and I have talked about my parents are independent, more or less, but they're over 80. So it could change overnight, right? Like one
Mhm.
bad fall or whatever it may be. It's always good to do some of your research so that you're not making a decision, often emotionally, last minute, right? Or you're in a crisis mode. And so I always tell people think of home care as an investment. You wouldn't wait until your car starts breaking down, right? You want to do some maintenance before. And so that's where a lot of my clients start. They'll start with 8 hours a week, 12 hours a week, and we build that rapport. And as their needs change, we can flex to that.
So let's talk about some of these because we want the power partners to know what should trigger a call to you, whether it's a client or in their own family, for instance. What are the situations, the conditions, the things that they're hearing, words or phrases that come in, whereas it's time to call Chrysler.
Yeah. I think of it as if you're listening and you're an adult child, look, July 4th is coming, right? Let's say you're visiting your parents, you haven't seen them in 4 months. Observe, right? Look for signs. So whether they're forgetting things, a loved one or an elderly parent, let's say the falls have been happening more frequently, bruising, it's very easy to bruise with their skin, elderly, even personal hygiene, if they stop showering. Um, these are all things to look for. And I coach a lot of adult kids on this because at the end of the day, just like my parents, they don't want help. It's scary. They want to be independent as long as possible. And so telling your aging parent you need care now usually doesn't go well. You should be asking more open-ended questions, and it takes time. That's what I'd say, right? How do you feel if we had a little extra help? How will that free you up, mom? Example, if you're the primary caregiver for dad, as an example. So those are all things, and of course, looking for burnout symptoms as well, right? If a elderly parent or a family caregiver is expressing emotional burden or is not sleeping or is always anxious about a loved one, these are all common triggers to give a home care agency a call.
You go over these signs in your YouTube conversations, right? I know you talk
Yes.
about them and then you talk about with other people. Are there anything else that you'd like to mention along with signs that come up? I think you talked about the emotion, bringing up the conversation is always hard, asking open-ended questions, things like that. Anything else that would help? Because when you bring somebody in, the person getting the care has to buy in too. Otherwise, they become belligerent, right?
Yeah, I would say belligerent might be too strong of a word, Alan, but I hear you.
Too
I've
strong of a
gotten that.
word.
Yeah.
I've heard this before. The person's 91 years old and they're like, I'm good. It's like,
Yeah.
how do you cross that? How do you get over that? Because that is,
Yeah.
I'm sure people are more cooperative a lot of times, but sometimes they're not, right?
No, it depends on the person, right? I've worked with clients where they fell and spent the night in the garage and still don't want care. No one, you know what I mean? No one knew that they were stuck in the garage. That's why I say I always tell people it's a marathon, right? It takes time. You can't force someone, especially if they're cognitively 100% there, right? Now I'm not an elder law attorney, right? That's where I refer out, right? But when you get into, are they capable or cognitively able to make decisions, right? So,
But getting somebody who is not sure or struggling with
yeah,
this, calling you, and from what I've learned about you and your ability to understand the relationships, the situations that they're in, and
yes.
ease them into the help that they need, it's as simple as calling you, right?
Yeah, yeah, no, absolutely. Yeah. I'm happy to talk to any family, right? And just give them options, right? I'm not here to fully convince someone of something they don't want or need, but I'm here to educate on the options, right?
And I would assume that go the same with the power partners, the attorneys, the financial advisors, estate planners. Don't have to, they just have to call you to call their client. Because this is a very personal, can be emotional and sometimes highly charged conversations or situations. And but the end result is that they're going to need some help in some fashion. They're going to end up in the hospital or worse,
Yes.
from what I've heard and seen. This is why I like to, from a power partner's perspective, is saying we're covering a base called home care service. And it's almost like bankruptcy. Nobody wants to deal with it, but if you have to go into bankruptcy or you have to learn about it, then you talk to a bankruptcy attorney. If you're maybe not the best analogy, but the point is that we all are going to hit this point, and most people are not prepared financially for it, or they're old school in the sense that, oh, the family's going to take care of mom or dad, when in reality the family's not going to take care of mom or dad. It seems like that somebody has to take care of mom or dad, or it gets put on one person. There's a
Mhm.
variety of situations, and I think that having a good resource helps to bring things in order. It seems, I think you have the ability to talk with the family, get things get understood so that you can have a good outcome. Would you agree with that?
Mhm. Yes, yes.
Because the way I look at it is that within Power Partners, we want you to be the go-to in this situation where we don't have to think so much about all the things that could happen or the reasons why. If we can bring you in, I think it simplifies things, is to let our power partners know that you simplify the whole process for them or their client.
Right.
Okay, good, good. Besides that, how do you have other ways to make it easier for power partners to understand what you do or how you can help them? Are there any, or how I can help you with some of my connections in assisted living facilities, like through brochures or anything that would help me introduce you to new prospects?
I think, Alan, even really starting this conversation, right? Since I met you, I'm just trying to understand each other. I always go back to trust, right? Do you, I even tell people to go look at other home care agencies, talk to people that work when they're looking around looking for care. It goes back to that, Alan, is me getting to know you and the network that you have, right? I'm happy to provide brochures or one pagers around, hey, more around or information around our services and what we can do. But one of the biggest things is, do I trust this person? Will this person go above and beyond, right? And when things happen, and things do happen in healthcare, Alan, right? In the home care space, not everything, it's not always smooth. Then it's a question of, will this person communicate, right? And solve whatever's happened. So that's the biggest thing, Alan, right? For all your power partners, even for your network. I'm happy to talk to anyone. I'm happy to provide brochures. But the most meaningful conversations I had is really just getting to know the person. I think about the first time you sat in my office 2 months ago. We just had a cup of coffee and we talked about life. We talked about travel, right? You just came back from
Yeah.
your travels. And so I think of it as approaching it on almost in a human perspective of
Well,
educating people. Yeah.
I agree. And me and you are past that point with trust and everything. Now we can go, but getting, say, a skilled nursing facility or a patient liaison who knows a lot of home care services and things like that. How do we transfer that trust to them? Is it a in-person meeting? Is it a phone call? What works best for you?
Yeah. For me, I love in-person meetings if we can get it, whether it's a coffee or a lunch, something casual. And then it's an ongoing relationship, right? Around, can we help each other out? Can I make their lives easier, whatever they do, if they're a patient advocate or they're a social worker or a discharge planner at a hospital, so that they know if it's going to Right at Home Long Beach, if it's going to Chrysler, he's going to take care of it. I don't need to worry, right? Because they already have enough of patients that they need to worry about.
And when you talk about that discharge planner person there, how hard is that to make that initial connection? Because getting in the hospital, does it usually come from an introduction or is it a cold call or,
Yeah, yeah. So it's hard, particularly for hospitals, I would say. Since COVID, they haven't, and I understand why, right? It's not as open, hospitals. So a lot of times it usually is an introduction, or if you meet them casually somewhere else, is probably the easiest to build that rapport relationship.
okay. Good to know. That's on my list to help with in that regard. A lot of it is you have to be proactive. Our power partners have to be proactive and understand what you do, at least to make the introduction, at least to first understand what you do, that you're there, and then get you to the person that you need to meet. And I know these things take time, and that's why I said timing is involved with a lot of positive outcomes. But I think consistency and willingness to be proactive and make the call, write the email. And so that's what we're trying to do it with our power partners in me personally, and then as power partners in related fields get to know you doing the same thing. You'll see that happen. It might take a little bit of time. It's not easy.
Sure. Yeah.
But it happens. It does work. It will work in the sense that our network is very proactive. It's just timing is involved with it. So what would you say the biggest problem or problems Right at Home solves for your clients?
Yeah. I think the biggest problem is, how do they stay safe in the home? Stay safe and healthy, or out of the hospital or healthcare system. And so I know a lot of people focus on the medical side, whether it's nurses or medicine, but a lot of people don't talk about, are they getting the right nutrition? Are they eating? Is there someone reminding them to eat? I work with a lot of seniors and they'll forget their medicine, and that puts them in a bad spot, right? Or if you have a caregiver there and no families around or friends, even if it's 2 or 3 times a week, we notice things and we chart, right? We write changing conditions and things of that nature, right? So think of it as a prevention for someone in the home. And so that's the biggest thing, is keeping them safe and aging in the home longer. I think that's the biggest problem that we solve.
Okay. And are you seeing families wait too long before seeking help, or why did they wait too long before seeking help?
Yeah, I think, yes, I think a good amount of families do wait too long until there's a crisis or until someone has fallen multiple times. I think it's twofold. Why? You asked why. I think one is whether their parents or their loved one doesn't want the care and they don't want to step under boundaries, right? Or they want to maintain that independence for a loved one or a parent. And so they don't want to fight about it or bring it up too much. And then I think number two is, I get it. If you see functionally mom and dad seem okay, why do we need caregivers even as they age, right? Until there is an actual medical need, right? Or they can't walk anymore or whatever it may be. So there's a delay in that factor around getting care.
Do you see maybe a minimum of 4 hours turning into 6 or 8 hours as the person ages or needs more help? Or do they usually start and stay in the same amount of time?
No, it's very common for our long-term clients. As they age, they may increase the hours. So you might start with something. I've had patients start with 4 hours a week and they were with us for 2 years. And so by the time we finish, they're at 20, 24 hours a week. And then, so it just depends on the condition, right? We're there to only provide services when they need it and want it and understand the value of it. We're not there to provide extra amount of hours that you don't need.
Okay. What role do the adult children typically play in the decision-making process?
Yeah, so it's very common that adult children call me first. So they're the ones doing a lot of the research. Again, they understand the internet, they're accessing internet, they're looking at all kinds of information, talking to their friends and family. So there's a lot of research involved with adult kids. Even just last week, I had two in-home consultations. Both were the adult kids that set it up. They did their research, they found my YouTube channel, they found our reviews, and we went and did an in-home consultation. Actually, both assessments or consultations, the adult kids were not present. They actually joined via FaceTime because they weren't in the area. That's an example. And then from there, in this case, both of the clients, 100% cognitively there, they can make their own independent decisions. And so the adult kids did a lot of the legwork, as an example, but the final decision rested on their parents in making that decision if they wanted care or not. And then from there, the adult kids, more often than not, we're handling the billing and invoicing with the adult kids as
Mhm.
well. Yeah.
And are you usually reporting to them?
Usually, adult kids, particularly if they're not in the area or they're out of state or another country, we actually have a tool called the Family Room that allows anyone, if we give them access, to our care notes. So what we write after every single shift with a loved one.
And what is the best way for potential clients to reach out and start the process of hiring your services?
The best way is to just give us a call at our office line, 562-786-6773. That line gets picked up 24/7. So you're almost always going to reach a live person. If not, within a few minutes, someone's going to call you back.
Okay, Kreisler, can you tell me about your caregivers, how you go about hiring them, evaluating them, and keeping them as part of your team?
For caregivers, we only hire experienced caregivers. What I mean by that, Alan, is when we see an application or we are recruiting, we're looking for someone with at least 3 to 5 years of experience, ideally in home care and or in a facility. And a facility can be an assisted living, or it could be a nursing home or a skilled nursing facility, or even a hospital. What we find is people that are comfortable in facility settings have, I would argue, better technical skills because they're being watched by a nurse. They've repetitively done it thousands of times. Let's say rotating someone or transferring someone out of bed. But then people with home care experience, it's a completely different context and environment. You're usually one-on-one, right? In a facility, it could be 1 to 10 residents as an example. But here it's one-on-one. So a lot of things are, yes, you have to have the technical skill sets, but I always say there's a lot of rapport building, right? Or in this space, we call it companion care, but there's a lot of trust. I talked about trust a lot. So it's building trust with your client or your patient and being flexible and understanding where they are. And you're in someone's home, as an example.
How do you interview for that rapport builder?
Yeah. One of the questions we like to ask is, what's the most important thing when you bathe someone? And there's no right or wrong answer, but a lot of people would just go into safety. Safety. I just want to make sure that they're comfortable with the temperature of the water, or I transfer them properly on the bench. They're not going to slip, as an example. All very important things, Alan. But you asked your question, how do you screen for something like that, right? In terms of, I'll say bedside manner, right? I want people to say, yeah, that, and I am talking through what I'm about to do before I even do it, right? I am asking, how do you like the temperature of the water? I'm about to transfer you now, Mr. Smith. So what I'm going to do is I'm going to put my arm around here, right? You're going to hold on here and you're going to move over here. And so even that tells me that the person understands that no one likes surprises, right? They understand they're going to move you, right? But you're talking through care, particularly for the first few shifts when someone is very new to you and all of a sudden you're in their most intimate moment, as an example. So that's just an example, right? When you ask, well, what kind of questions we may ask, I'm looking for something a little bit more than the technical side of safely transferring someone. But are they building rapport with someone while they're doing it?
So like somebody with 3 years experience has seen it all. Somebody new though, can you tell if they're like built for it?
Yeah, I think for us, if they're new, again, first, we don't typically hire new people. It's more of an exception based if it's new. I think it would be, to me, off top of my head, it would be more around, are they going to nursing school? That's a very common thing. We see someone who is almost like a go-getter, right? Like, oh no, I want to be an RN, right? I'm just doing this as a stepping path. That's why I'm brand new, Kreisler. And they have the personality for it, right? The patience for it. Because it's hard work, caregiving.
Yeah.
It's hard work. And so that's what we're looking for of, okay, if you don't have the technical skill sets, you're brand new, or you're in nursing school, tell me a bit more about yourself, right? Your personality, your values. Are you someone with patience? Are you someone who can think on their feet? Because things can change in a given shift. So those are our things we're looking for if they're brand new.
Right. Yeah. You said they require experience. They should come in knowing what to expect, that they want to be there. So when you have somebody that is good, they're working directly for you. So they're not independent contractors, they're employees.
No.
You're keeping them like busy, employed, right?
Yes. Yes. They're all employees. This is a big area that I always ask people when they call me and they're shopping around. They're calling different home care agencies, as they should. I always tell people, just be careful who you hire, right? Find out if they are employees or they're contractors. Because if they're contractors, you're technically liable in the home, not necessarily the agency for anything. Yeah.
Right. Do you have a fairly big territory? Southern California is vast, diverse healthcare needs. Do you find that different communities have differences in healthcare needs? Long Beach versus, I don't know, I'll say Montebello. Just from one section, from one city to another, are things pretty consistent, or do you see differences in different cities?
I think things are more or less consistent. I think price sensitivity, that's what I would say. I'll use that word at times of pricing, may be slightly different from community to community. I'll give you an example. I've heard in Orange County and San Diego, home care agencies are doing $40 to $50 an hour, right? So drastically different from LA County in terms of pricing. Minimums could be different. Again, we have low 4-hour minimums at times. We'll do 3 hours if we have local caregivers really close by. Gas is really expensive these days, Alan. So there's always that running joke of, we want to make sure that we get the right amount of care, but we also want to make sure we get the right caregiver in place. Yeah.
So that's okay. You answered the question, but is like the need of what the caregiver has to do, that stays pretty consistent across the board.
Yes. Yes. For the most part.
Good to know. Just curious, do you see any role technology will have in the future in home care, healthcare, staffing, or is it more on the administrative side? Home care is going to be always a relationship, hands-on business.
Yeah. Yeah. If I may speculate, Alan, I have some strong opinions on this. I think for the immediate future, what I mean by that is for the next 5 to 10 years, people want human connection. People want a human take care of another human. But I do think technology does play a key role, right? All the way from, I would say, monitoring someone. There's things there's an Apple smartwatch, right? There's rings. There's things people could walk wear around their neck, pendants. I've worked with vendors they can install monitors in the room and they can measure if they're falling, what time they sleep, what's their wake window, what time are they waking up or sleeping, how are they eating. These are all data, essentially. So to inform how someone is staying safe in the home. I think there's an element of that can supplement home care. I think there's an administrative side. I came from a tech background. And what I find, Alan, is healthcare is probably 10 to 15 years behind tech in general. So even things around scheduling, the software we use, we still fax a lot of things. Those are all things I think we can improve on in tech on the back end. And then lastly, I do think, and might not be as popular to some people, Alan, I think when they get the robots right, whether it's 15 years from now, 20 years from now in the home, I think there's an element of that as well to supplement, particularly if we don't have enough caregivers, there's a caregiver shortage, and we have a huge aging population that continues to grow.
I could see that. The advances in the robotics is there. It's like anything else, it's the acceptance of that. And a lot of times it comes down to cost, right? Is it cheaper
Yeah.
than a human? If it does what says it'll do, you do see that as a probability then.
Yes. Yeah.
Do you know by any chance like where those are being developed right now, or is it a Chinese thing, or is it mostly?
I mean,
Is it?
yeah, I think the Chinese are really putting in a lot of effort to robotics in general. I know there's one or two companies. The most popular one is Optimus from Elon Musk, right? But I think the hardest part is ambidextrally, as I've heard, our hands are very complicated and it is very hard to code as well as the hardware, right? To have that dexterity of our hands, if that makes sense.
To give a pill or something.
Yeah, or to do housekeeping or even to help lift someone up, right?
Yeah.
But yeah, it's exciting. I think it's exciting, depending on how you view it, though.
Just something to keep an eye on, right?
Yeah. Yeah.
Okay, good. In the meantime, let's see here. What are your goals or aspirations for Right at Home Long Beach? How long you been at it now, and what do you see down the road?
I've been at it now for about 3 years now. And so still early days, right? I would say still early days. I don't have a vision of growing it into something where it's not boutique. What I mean by that, where there are large agencies that do hundreds of clients at a given time. But I've always had this vision of 100, right? What I tell people, if I could touch 100 people at any given time, if I could have 100 people in the community vouch for us and support us, and if I could have 100 caregivers, that would be the end vision or end goal.
Does referrals like you might have success stories, right? A client is happy with your services there overall. Do they tend to refer out? Are they part of that 100, or is it they're isolated and you have to find another?
Although they're part of that 100. At the end of the day, I think this is, as I said, it's a very trust-based type business, right? You're dealing with a loved one in their home. So yeah, no, I think that top 100 includes power partners, right? People in the community or former patients or clients.
Okay. All right. Any developments in the law or things that you see coming down the pike? I understand that, how is it that can the state provide any kind of home care help for people? And is that something that you go for? Is that a separate area or something that you?
Yeah, so it's a separate area. So Medi-Cal, the Medi-Cal program, which is California's version of Medicaid, they do cover home care. It's a different program called IHSS, in-home support services. And so they will approve a number of hours per week. Agencies don't operate in that environment typically. It's usually direct to caregivers. So whether a family caregiver can be an IHSS caregiver for a family member, as an example. So that's I would say the only, I think you asked around government type regulations, things are upcoming, right?
Yeah.
So that's the only thing that covers home care. What I am excited about, I just saw recently last week, probably years away, I actually think, but there are some senators building frameworks around how do we get Medicare to cover some home care. Even I mentioned the Guide Dementia program earlier. It's an 8-year Medicare pilot. So it just launched last August because historically Medicare has never covered home care. So it's exciting to see that governments, right? Some of our government leaders see the need to help families out because I think it's bad, right? When I talk to people who have been the family caregivers for years and they're using all their money, they're helping their loved one, right? And there's just no support system around this at all, even though you've paid into your Medicare as an example. Yeah, so that I'm excited about, of even some help for some families who can't afford it.
And what is that going to take politically? National, it's not going to be a national thing. It has to be a national.
Yeah, this is where I don't know enough. I just saw that some senators were drafting frameworks around it, but not to get political, Alan, right? But our government is in a lot of debt, right? So it's a question of where do the funds come from, right? I'm a big believer in it, of course. I'm a big advocate of the course because I'm in the industry, but I also understand who's going to pay for it, right? How do we cover this? And I do think the math can work. If we keep people out of the healthcare system and in the homes longer, it's cheaper.
Yeah.
It just is. I look at what's being charged by these nursing facilities. Bless their heart, I work with them. Someone could stay in a month and be charged the government $25,000, right?
Yeah.
What if we got home care for them and it was, I'm just making the numbers up. It was $5,000 for the month, but we kept them out of the facility because they ate their medicine and they didn't fall.
Yeah.
Oh, okay. I think, I think there's a
Seems-
conversation to be had there. Yeah.
Seems simple enough, but okay, good to know. All right. Anything that you'd like to include that we missed? The final comments or anything you'd like to?
I think the final comment is I just encourage people to think about long-term care, not necessarily just home care. Long-term care in general, as if you have aging loved ones. Whether it is I got to build a trust or a living will first with my lawyer. You don't need a ton of money. That's the other thing people think. You need a ton of money to engage a lawyer to help you build that. But I think just doing that long-term care planning, because long-term care is not covered. Remember, I only said only the medical side, right? Long-term care in terms of assisted living, home care, none of it's covered by insurance for the most part. So talk through that. I encourage people to talk through that as a family. What that may look, even though your parents are healthy, relatively speaking, you don't want to do it in an emergency. So you want to have directions in place. I've seen families rip each other apart because they don't have direction in place. So the kids start infighting with one another. So that's what I would say, is I just encourage people, just like anything else, you want to plan for it. And God willing, you don't have to execute it, but you at least have your wishes of a loved one, what they want done and how they want to be taken care of in the latter part of their life.
Okay. And then another question I have is, we've touched on a lot of items here, but your YouTube channel, I haven't had a chance to hear all your videos, but have we touched on some of those? Have you talked about some of the similar things in your videos, or what did we not talk about that we might find in your videos?
No, for the most part, you talked about it, right? There are signs of home care, how to pay for it. Excuse me. I engage with different professionals in senior healthcare professionals as well. No, I'm just out there advocating, because there's a lot of information people don't see or know where to go to. And so I think home care is the element, but it's not the only element.
Yeah, there's also the emotional part, dealing with the emotional part of, heard that one.
Yeah.
It's compelling because it gets to the heart of why you need this or when you need it. So that's good. Glad that you got some business from it. People did their research and came across that, and they could get that information from you. That's great. I would like to thank you, Kreisler, for being a power partner and joining us on this podcast. We look forward to promoting you inside and outside our network and being part of that 100 and part
Yes,
of
sir.
your circle as well.
I appreciate it, Alan. Thank you so much for the opportunity.